Hi, my name is Martha Covrig and I'm one of your school district nurses. Today we're going to review and hopefully share some new information that will help you be COVID safe. COVID-19 is caused by a virus that is more likely to spread between people that are in close contact with each other, within 6 feet or 2 arms lengths, through droplets that are produced when an infected person coughs, sneezes, sings, talks, or breathes. An infected person can spread the disease without showing symptoms. These are symptoms of COVID-19. Primary symptoms include cough, shortness of breath, difficulty breathing, fever or chills, and a new loss of taste or smell. Other symptoms could include fatigue, muscle or body aches, headaches, sore throat, congestion or runny nose, nausea, vomiting, or diarrhea. You must stay home from school if you have COVID-19 symptoms, especially the primary symptoms. And always stay home if you were exposed to a person that has COVID-19. Contact your doctor or clinic for testing and treatment. Get medical care if your symptoms worsen by calling 911 or going to the hospital. Serious symptoms are trouble breathing, persistent pressure or pain in the chest, new confusion, inability to wake or stay awake, bluish lips or face, or any other symptoms that are severe or concerning to you. What steps can you use to be COVID safe? Hand washing, wearing masks, physical distancing, and staying home when sick. These are some of the most important things that you can do to be COVID safe. Step 1. Hand washing. Hand washing is one of the most important things you can do to prevent germs from spreading. This video includes some important information about hand washing and use of hand sanitizer.
Washing your hands is easy, and it's one of the most effective ways to prevent the spread of germs. Wet your hands with clean running water. It can be warm or cold, and apply soap. Lather your hands by rubbing them together with the soap. Wash the fronts and backs, wrists, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. You can sing the ABC song once, or the Happy Birthday song twice. Rinse your hands well under running water and then dry them with a clean towel, or air dry them. Turn off the faucet with a towel. If soap and water aren't available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Apply the sanitizer and rub your hands together until they're dry. This should take about 20 seconds. Wash your hands before you eat or touch your face. And after you use the restroom, go outside, blow your nose, cough or sneeze, or touch your face covering. Remember to follow everyday healthy habits. Wear a cloth face covering, stay 6 feet away from others, and stay home if you're sick. If you have any questions, contact your school nurse, working on the front lines of the COVID-19 pandemic in schools.
Step 2 is wearing a mask. Some important guidelines about wearing masks are included in this video.
It's important to wear cloth face coverings when you're out in public and around people who don't live in your household. Face coverings act as a barrier to help slow or reduce the spread of COVID-19. Check with your school for information on face covering policies. Wash your hands before putting on your face covering. Put it over your nose and mouth and secure it under your chin. Fit it snugly against the sides of your face, but make sure you can breathe easily. Don't put the face covering around your neck or on your forehead, and don't touch it. If you do, wash your hands. Never share or swap face coverings. When you get home, carefully take off your face covering by stretching the ear loops or untying the strings behind your head. Fold the outside corners together and put it aside for washing. Then wash your hands. Cloth face coverings should be washed and dried after use each day. Label your face covering with your name or initials. Bring a backup in case it's needed. In addition to wearing cloth face coverings, remember to follow everyday healthy habits. Wash your hands often, stay 6 feet away from others, and stay home if you're sick. If you have any questions about wearing a face covering at school, contact your school nurse, a trusted resource for students, parents, and staff.
Step 3 is social distancing. Being COVID safe means keeping your distance from others. We should stay 6 feet from people that we don't live with. That includes school. Make sure to follow directions in our schools by obeying the directional signs and staff instructions. Avoiding crowds is important. Schools are using a hybrid schedule to make it possible to allow for proper distancing. The more people we are in contact with, the more likely we are to be exposed to COVID-19. That is why class groups are smaller right now. This includes when we are not at school too, though. Social distancing helps us all stay safe and keep other people we care about safe too. Some people are higher risk, so when we take steps to lower the risks, it not only helps us remain safe, it helps everyone. The elderly, those with weakened immune systems, and pregnant women are some of the high-risk groups. Key times to practice social or physical distancing include when someone has COVID-19 in your home, or even if they think they have it. If possible, stay at least 6 feet away. You should stay at least 6 feet away from people that you don't live with, both inside and outside. Stay out of crowded places if possible. Step 4. You should stay home if you are sick. That includes work, school, and any activities like sports or music, any in-person event. Although this video says to stay home 14 days, you should follow school and local public health guidelines regarding when you can come back to school. Watch this video and learn what to do if you are sick.
If you're sick or think you might have COVID-19, it's important to stay home and away from other people. Some of the symptoms to watch for are cough, fever, sore throat, vomiting, diarrhea, loss of smell or taste, headache, tiredness, and muscle pain. Most people with COVID-19 have mild illness and can recover at home without medical care. Manage your symptoms by getting rest and drinking plenty of fluids. Cover your coughs and sneezes with a tissue. Wash your hands often with soap and water for at least 20 seconds. As much as you can, stay in a specific room, away from others who live with you. Avoid sharing things like towels and dishes. Stay aware of how you feel. Contact your healthcare provider if you're worried about your health. Call 911 if you're having difficulty breathing, staying awake, chest pain, or blue lips. When can you go back to school? That depends on different factors. Check with your school to find out specific policies. If you had close contact with a person who has COVID-19, you should also stay home or quarantine for 14 days and monitor your health. If you have any questions, contact your school nurse, the healthcare expert at your school.
You may have heard the words quarantine and isolation. What do they mean? Quarantine is the term for staying home if you were exposed or around someone that is sick with COVID-19. Isolation is the term used when you protect others by staying home and separating from others when you are sick and when you test positive and have primary COVID symptoms or other contagious illnesses. You could get COVID-19 if you're exposed to someone that is positive as much as 2 days before they start showing symptoms. It's even possible to spread the disease if you don't have the symptoms. That's why it's important to use the steps we've talked about today. Use them consistently. Wash your hands, wear masks, social distance, and stay home if you're sick.